Knowing what to expect from your first year as a registered nurse is key for helping you prepare to hit the job market and for work and life as a modern nurse. Well, rather than learning all of this the hard way, I've got registered nurse Casey Smith here with me today to give you some excellent advice on how to navigate your first year. Well, Casey works for a company called Trusted Health, which places nurses and travel assignments throughout the United States. They're also a crucial resource for the modern nursing community, which makes Casey a great person to speak to about the directions and decisions modern nurses should take as they embark upon their careers. So without further ado, let's take a peek under the skirts of year one as a new nurse. Okay, Casey, tell me, what does it mean to be a modern nurse?
Well, I think that a lot of people have this image of a nurse. They think of a middle-aged white woman wearing a white hat, a white nursing outfit or a dress. And I think I just want to persuade people to help them understand that a nurse can look, speak, act, and live completely different from that common view of nurses. They're innovative, they drive change, they are leaders, they're adaptable, they're flexible. We are, in my opinion, the heart of healthcare. And as we move healthcare forward, we're definitely going to be at the center of that. And we need to be at the center of that to drive change, which, as we can see the last year, change does need to happen, and we need to continue moving forward and do better.
Yeah, absolutely. Okay, well, let's say that I'm a freshly licensed nurse ready to embark upon my career. Realistically, walk me through what I can expect from year one of employment, the good, the bad, the ugly.
Oh, this is a great question. So I look at it this way, and this is just general assumptions, but the first 6 months are pretty terrible. I say this honestly. There's a lot of imposter syndrome. You're learning not only how to navigate how to be a nurse, but you're also learning how to navigate, unit social dynamics, how to be a professional, especially if you're straight out of college and this is your first career. There's a lot there that you're trying to learn. And so I think it's really important for nurses, especially in the 6 months, to give themselves grace and understand that no one expects you to know anything. I think that nursing school does a great job of giving nurses theoretical knowledge, but it doesn't necessarily do a great job of helping nurses develop their critical thinking and how to apply that knowledge. And so that's what you're going to learn at the bedside, and that's what you're going to learn on the floor. You're going to learn actually how to be a nurse after you graduate, not before. Wow. And so those first 6 months, I don't think that's actually told to nurses when they're graduating or in nursing school. And so they come in with this expectation of being like, I should know how to do this, or I feel silly for not knowing this. But in reality, no one expects you to know these things. So just ask questions this first 6 months and understand that they're going to be tough. Definitely, I encourage people to find their support system this first 6 months too. Like the people in the unit who are going to help you out, your friends and family outside of work, and always prioritize your mental health those first 6 months. 6 months to a year, I feel like you're like, all right, I'm kind of figuring this out. I feel a little bit better. And then I'd really say, I know you asked for the first year, but I really feel like at the 2-year mark, you're like, oh, I know what I'm doing. And I don't say this to scare nurses or new grads. I say this to normalize what they're going to feel when they get on the floor. Right. I want to be honest and set them up with the correct expectations, because otherwise I feel like I said, like the imposter syndrome sinks in, or they feel like they're not good enough, or they can't do this, when in reality they're right where they should be. Just no one takes the time to tell them that.
Yeah, you got to manage those expectations. Yeah.
Absolutely.
And I imagine that it must be an enormous crash course in patient psychology. Because if you think about, a lot of these nurses leaving high school, going to nursing school, by the time they're in a clinical environment, they're in their early 20s. And when I was in my early 20s, I definitely didn't have the emotional intelligence to deal with sick people who are scared. I mean, it must be, I can't even fathom it.
Absolutely. And I totally agree. And I feel like that I was like learning how to be a better person at the same time. You're that age. I was the same age. I was like 22, and I was young and somewhat more selfish, and you just learn. I think that typically the type of people that are attracted to nursing are innately empathetic, but then it's like a muscle. You learn how to have compassion for other people, and you learn how to become even more empathetic and help people in these situations. And it's just so, it's like life-changing being a nurse. It really is. It made me a way better person. And I'm really proud of being a nurse now because of those experiences. And I know I talked about the bad and ugly, but the good kind of leading off of this is just, you learn how to connect with people. You are their rock during their moment of crisis, you know, and I think it's such an honor to be in that role. I can think of countless times where, you know, when I was there, I was a pediatric ER and trauma nurse prior to my current role. So I did that for 6 years, and I worked at all level 1 trauma centers. So I saw the sickest of the sick, you know, the kids coming in from car wrecks and everything. And so I was a person in the room that parents would look to. The doctor would tell them something, but they would look to me and be like, can you help me understand this? Can you help me through this? And that's just such an honor. And there's no other profession. You know, I think it's been the most trusted profession for over 18 years. I can't remember exactly, but there's no other profession where you get to serve that role and be that person for so many people. And you were going to be that person really early on in your career. And it's going to be hard, but it's just amazing too, to be given that opportunity.
Oh, so noble. Wow. All right. Well, tell me what's different about nursing in 2021 in terms of job opportunities and employment challenges.
So I think this is a great question because I think that it is going to be a little bit different from what I've seen. With the pandemic, we've seen nurses leave the workforce. They're retiring early or there's burnout. And so I think that obviously there's going to be a shortage of nurses with that. And we already don't think I have enough, at least in the US, like enough education systems in place to educate the people who do want to be nurses. So there's multiple factors there that are driving a shortage of nurses. And I think that with that, you're going to see probably maybe a mild increase of opportunities for new grads. But I want new grads to understand, if you don't see those, or even if you see a decrease in those opportunities, it's because it's really expensive to train a new nurse. There's a lot of time and a lot of money. It's a huge investment for a hospital. But I still think there'll probably be an increase in new grad opportunities. And then I think our whole entire nursing workforce is going to become more flexible and more dynamic, because their hospitals are going to be turning to travel nurses. They're going to be turning to other kind of like short-term solutions to treat the kind of the staffing crisis that we'll probably see. So there'll be more travel options for nurses. And there's also, I think nurses have proved themselves to be wonderful employees across multiple different industries. So there's also going to be a lot of opportunities away from the bedside for nurses. So if you get into the bedside and you're like, this is not for me, that is okay. You are still 100% a nurse away from the bedside. No one will ever be able to take that away from you. I do, community marketing now, and I'm still 100% a nurse, and that is who I identify myself as. So there's gonna be a lot of opportunities there for nurses to explore in a lot of different industries. So to summarize, our whole nursing workforce is gonna become a little bit more complex and a lot more dynamic, I think.
It's exciting. Mm-hmm. Yeah. All right. So this kind of goes hand in hand with my previous question, but what skills and mindset do you think the modern nurse needs to be successful?
I think that we've already kind of touched on a little bit, but definitely more flexible and adaptable. And I think especially after this past year and being a nurse myself, I think that it's really important for nurses to find their own voices and to learn how to advocate for themselves, their patients, their coworkers, our profession as a whole. I think it's going to be really, really important for nurses to understand how to speak up for their needs if we're going to be able to move the entire profession forward, which needs to happen right now. Mm-hmm. And so that modern nurse, I really hope they join their communities on their unit. They join the national associations. They, ask for change. And then at the end of the day, if their needs are not being met on their unit, if their mental health or well-being is suffering because of their job, they also need to take responsibility and leave that place of work. And I really encourage them to do what's best for them, because at the end of the day, this is a job, and you should never suffer because of the job, to the extent that, it's affecting your mental health or well-being. So the toxic place of work, leave. There's no employers out there.
Mm-hmm. Amen. Well, so Trusted Health has worked with many nurses that have left the bedside to pursue different paths, as we mentioned earlier. But can you tell me a bit about some of the more unexpected or unique jobs you come across in your day-to-day?
So I want to touch on a few of the jobs I've seen on our platform. We offer travel assignments across all 50 states. So I think these are a few really unique ones that I've seen that are kind of different from the standard jobs. Then I'll touch ones I've seen actually outside of what we offer on our platform. But I've seen it where it's like a transport ship. They needed a nurse on board. And so I think it's like a 6-month stint between California and Hawaii that they'll be on board the ship and provide like medical services and resources to anyone who's working there. And then one that was really fun is that we have had several nurses staffed at HBO. Right? Isn't that great?
Wow.
Yeah. And so they have been managing like the COVID protocols. So
yeah.
So that people are adhering to the creating and making sure that people on set are adhering to this protocol. So some of the big shows that you see out, might have a trusted nurse at them that's kind of making sure everyone stays safe, which is really cool. And then obviously there's been like a lot more remote positions, like telephone triage, all of that. And then outside of that, so at Trusted, I am able to host a lot of events. And my goal with our events is to kind of help kind of close the gaps on bits of information that are hard for nurses to obtain, especially related to their career. Like what else is out there, right? That's actually a series we did. What else is out there for nurses? And so I came across so many different industries and career paths for nurses that is just wildly different than what nurses are typically exposed to. For example, cannabis nursing. More and more patients are using cannabis, and so we need to be educated and help them, how to use it safely. And so that's something that we've done a seminar on, and I've seen, and I worked with cannabis nurses for that. Aesthetic nurses, nurses who do Botox, whatever. There are a lot of nurse inventors out there and entrepreneurs who are creating their own side hustles or businesses. I've worked with a lot of nurse writers. There's forensic nursing. The options are endless. I think that if you really are interested in a path, like you can forge your own with nursing.
Right.
I don't think people realize how much nurses have to offer outside of the bedside skills, how much of those skills are actually transferable to other industries. And so it's been really fun working with all these people who I've worked with nurses who are nurse architects who help design hospital floors, or nurses who have sit on company boards and provide advice to the healthcare companies. We have a chief clinical officer at Trusted, and he's a nurse. Dr. Dan Wayberg, he's one of my favorite people at Trusted, and he's fantastic. And so there's a lot more remote roles too. And even with Trusted ourselves, we hire nurses across the company. I sit on the marketing team. We have nurses who are nurse advocates, and they help help our other nurses find jobs with us and support them. We have nurses who support them once they're actually working and on their units. And we have a nurse engineer. She codes all day. So really, like, nurses you can do a lot more than they realize. You just got to start with.
If you have any interest or skill aside from your nursing education, it's like you can just blend the two and come up with a perfect niche for yourself. It's just, crazy.
There's a fantastic, she is a nurse leader. Her name is Dr. Beth Brooks, and she talks about just that, how you can forge your own path. And so if you're interested in doing something, find someone who has done it before and ask them how they did it, or simply forge your own path. You find a company, you're like, wait, they need a nurse on their board. This would help out quite a bit. Like, reach out to them, say like, I have so much to offer you. And most of the time, these companies are really responsive. They just don't know they need you quite yet.
Right. Yeah. Okay, all right. So, given the fact that you are a registered nurse and that you work daily with qualified nurses, what advice do you have for new nurses? Perhaps advice you wish you had had yourself when you first started?
I think the first one is definitely give yourself grace. We're going to make mistakes. We're not going to know what you're doing some of the time. And so just understand that you need to be able to give yourself grace to move past those harder moments in the beginning of your career. I think that along with that, it's really important to ask questions. And, everyone always says that, ask questions. But I really want to say, like, there's no dumb question out there. You're not going to be the first person to ask a question. And if you genuinely don't know, that is not your fault. I really want to reinforce that. If you don't know something, either, that might be the responsibility of someone else who should have told you something. So you're not holding all the responsibilities when you ask these questions. And I think that if anyone's not responsive to you asking questions, that's a reflection of them and not you.
I was going to say that I educated in the sciences, and I was always taught that no question is too dumb. And if somebody makes you feel stupid for asking a question, that is totally a reflection of their character and not your knowledge. So remember that,
Absolutely. And I say this too, like, it's a lot easier to ask questions when you're a new nurse and you're like, hey, I'm only, I've been here a week. Like, can you explain this? And then, like, only been here a month. But when you're a year later and you should have asked a question when you were there at the month mark, it gets a little bit harder to ask those questions. So I encourage you to ask them frequently and ask them earlier and develop those habits and get more comfortable with it. Because I think that's also a skill, is being vulnerable and learning when to ask for help. So that's for sure. I have like a whole other list of things too. I think that when you also are asking questions, I encourage nurses to develop their critical thinking. When you're doing something for a patient, you need to know the why. Why are we doing these labs? Why are we giving this medication? It just makes you so much of a better nurse. If you ask the why and understand what the why is, the next time you see a patient who's in a similar condition, you can already anticipate their needs. What you're going to do for their care. You're going to become more efficient and more effective. And then you'll also be able to advocate for those patients a lot better, because you'll understand the pathophysiology, the normal treatment plans, and why you do something, and also why something might be better for your patient than what your provider is currently offering. So it's really important to understand the whys. Really easy one is take opportunities for growth and learning. That's, get the certifications. Those are free. And if you leave the hospital and you go travel nursing, they might not be free anymore. And my favorite certification that I took, because I just learned so much and I was immediately able to apply it, was I got my TNCC certification, trauma and critical care. And then it's just so cool when you get these certifications, you learn something new and then you're immediately able to apply it in practice. It's different from in school, because in school you learn something and then you maybe see it at clinical and then you just like, I don't know how this applies to me. But typically when you're taking these certifications, you're taking them specific to your specialty. So you get to immediately put them in practice. And it just was, some of them were just really able to break things down for me and look at them in a whole new way and really help me grow in my career.
That's awesome.
I think I've already mentioned this, but I really want to reinforce the last two that I wanted to talk about was find your support system at work and outside of work. Being a nurse is difficult, whether you have 1 month experience, 2 years, 5 years, 10 years. You need to have your team at work, know who you can go to ask those questions, who wants to teach you, know who is going to have your back. If you've had a bad day and you ask them for help, they're going to help you with your patient assignment. Know who those people are and go to them and utilize them at work. It's going to really, find your village at work. That really makes a difference in your day-to-day and your shift. And you want to feel supported there.
Yeah, I can totally see that.
Yeah, absolutely. There's going to be, unfortunately, the way it happens, like there's going to be people who are not going to be the best person to be your preceptor or a part of that support system. And so just recognize who they are, and be cordial and professional, but but use others instead.
Yeah.
And the last one, I think that I'm a huge, and Trusted is too, we're a huge advocate for mental health for nurses. So it takes a toll on you being a nurse, whether, like I said, you're inexperienced, novice, or more experienced, just because we deal with more traumatic things. You know, I've seen children pass away. I've helped their parents cope through it. And then you also have these really stressful days and assignments, and there's just ongoing trauma that sometimes we don't always allow ourselves to heal from. We don't recognize it. And so if you've ever thought about, when you're a new nurse and feel like you're struggling, if you've ever thought about seeking help or finding help, that means you probably should. And so just know what resources are available to you if you're struggling or having a hard time, and make sure you utilize them. Take those mental health days, work with your unit, and definitely take care of yourself outside of work so that, you can show up and feel good about your job.
Yeah, I really think that can't be overstated, the importance of mental health. I mean, I could drive past a car accident and see someone hurt and cry about it. So I can't imagine going into a hospital every day and dealing with, patients. It's the empathy would probably just overwhelm me. So as a new nurse, seeing such trauma and seeing families torn asunder, you really have to not, look after yourself and get the help that you need to cope.
Yeah, absolutely. And, and I could throw out a lot of terms that probably means nothing to a new nurse, like moral distress and burnout and all of that. But the biggest thing is just, is recognizing when you're suffering because of what you're, seeing at work or whatever, and just understanding that it's okay to ask for help is the biggest thing. And I think I want to normalize those feelings because, most nurses will feel those feelings at some point, and it's normal, unfortunately, because of the nature of our jobs, and just know that it's okay and it's normal to seek help too if you need it.
Yeah, absolutely. Okay, cool. Finally, can you tell me a bit about how Trusted Health helps connect nurses with job opportunities and some of the other resources you offer them at different points in their career?
Yes, I would love to. Trusted Health is actually a company of nurses for nurses. We have a lot of nurses, like I said, at the company, but we currently place nurses in all 50 states through travel assignments. So we work with a lot of staff nurses who want to become travel nurses or nurses who have experience traveling. It's a really fun to help create these really special careers for these nurses. So I love being on that side of it. Specifically, nurses that, these are typically nurses who have 1 to 2 years of experience at least who travel with us, but we offer resources for nurses outside of that. We really aim to be a really quality resource center for nurses, whether you're a nursing student, a new grad, someone who has a lot of experience, someone who's been a staff nurse only, someone who's a travel nurse, wherever you're at in your nursing journey, we have a lot of resources. For example, we have a new grad resource center where we talk about, how to land a nurse residency program, how to interview, all of these different resources. We have a blog that covers everything from product reviews for nurses, personal narratives to, what is wilderness nursing, and goes into these deep dives in these different specialties. We have a specialty guide that breaks down each specialty and what that looks like, even the pay. We have a salary calculator where you can look up and find jobs all across the US, or you can look and see how much you would be paid as a staff or traveler in a specific city, the cost of living, the job outlook for that area, for example. It's really, really impressive. We have several products, all this content, and our social channels are really active. I used to be our social media manager before I kind of switched over a little bit to my current role. And we do a lot on our social channels too. We offer giveaways. We offer the sense of community, allow nurses to connect with one another. And we offer a lot of information there too. So it's just a really nice place to connect with us and other nurses and see what's going on in the nursing world. Get a little bit of new knowledge and also maybe a few laughs too, because we like utilizing humor.
That's perfect. Oh, Casey, well, thank you so much for speaking to me today. I really appreciate it. I think we've given some great value to budding nurses and those who've just embarked upon their career. So thank you.
Oh, you're very welcome. It's my honor to. So thank you.
Well, there you have it. The best advice on what it means to be a modern nurse, hitting the job market and navigating your first year of employment. Now, as I mentioned, Casey is from Trusted Health, which is a nurse staffing company that places nurses in travel assignments throughout the United States. So if you're looking for unique, exciting, and flexible nursing work, check out their website at trustedhealth.com. You can also find them on Facebook, Instagram, Twitter, and even YouTube. Details below. If you are studying to become a registered nurse or nurse practitioner, make sure you get Brainscape's NCLEX or nursing flashcards, which will help you study so much more efficiently and keep up that healthy cadence of daily review that is so essential for doing well in these content-heavy subjects. For even more guidance, check out the other videos we have on Brainscape's nursing channel and go to the Academy for A to Z study guides on how to excel in nursing school and beyond. These tools, together with your ambition and hard work, is everything you need to rise to your challenge.